Hello, everyone. I can see that many people are joining now this workshop, and I wanted to welcome you to this first, well, not first because we had one last year, but first of the many this year workshops that we are organizing in the framework of the Pharmacists for Greener Healthcare Network. So as you know, this is a network of sustainable pharmacists that we have built in the past year, and now we want to bring it to life. And we want to get you to connect to other pharmacists working in the field, working in different spaces, and addressing different topics of interests, like the one that we are going to cover today, which is related to medicines with extreme heat and medicines management, more than just conservation, like how climate change is having an impact on the way we use medicines and the way our patients need to take those medicines. This network has over 130 members. Some of them are here with us today, and some others will join us online because this webinar will be recorded and will be published in a private YouTube channel. So you will be able to follow what we discuss here. And a couple of quick reminders. We have one LinkedIn group that we are launching right now. So you might get an invite to that LinkedIn group very soon if you haven't already. But with no further ado, I want to introduce the two speakers that we have today. As you saw in the invite to this webinar, this is supposed to be a let's say, participative webinar. So if at any point you have any question, you can use both. You can use the question and answer tab, and you can also use the chat option to introduce yourself. So you can say who you are, where do you come from, and what are your concerns. And then at the end of the webinar, we will also share with you a sort of survey, a very short survey, where you will give us more details on what are your interests and how can we make other interesting webinars. So let me introduce our two speakers for today. They come both from Spain, but both of them from very different regions with a different impact of climate change. So we have with us Noé Garín, who is a clinical pharmacist at the Sant Pau Hospital in Barcelona, and he's also lecturer at the University of Barcelona and Blanquerna. And it's a region which is already quite used to climate change. I will give you the floor now, Noé, to present to give the presentation. But I want also to introduce our other speaker, who is Sayoa Domingo. She's chief pharmacist from the Bagoyena Health Service, which covers primary care, but also nursing homes in the Basque Country, which is in the north of Spain, but has very different let's say, issues than Catalonia in this case, in the case of Noé. Both of them are being impacted by climate change in different ways. Barcelona and Catalonia had perhaps more time to prepare because they were used to heat. The Basque Country is different sort of environment, very rainy, more let's say with not really warm temperatures until now. So we can start. I don't know if you want to say hello to the audience first, and then I can give the floor to Noé. So, yeah.
Hello, everyone. I hope we learn a lot and we can share a lot of experiences between us. Saya, do you want to say something?
Just hello, everyone, and let's see how this works. Thank you.
All right, so then it's over to you, Noé. Noé is gonna give a presentation on how is climate change and severe heat events affecting the day-to-day work basically in Catalonia. So please go ahead, Noé. The floor is yours.
So thank you very much. I think it's working right now. Otherwise, tell me. I will cover the topic global warming, health, and drugs. And I'll talk specifically from the Mediterranean experience in my region, which is Catalonia. I come from Barcelona, and I am a clinical pharmacist. So this clinical issue is also a very important thing. We will talk about this. So let's start with climate change. We all know that the universe is a very cold place. We are warmed up by the rays of light of the sun, and it's a good thing until we are warmed up too much because of these greenhouses gases like CO2, NO2, and it's making us to warm up very much because some of this heat is not dissipating into the outer space again. These are projections for 2050. In these projections, you can see, if you look in Europe, for example, very orange and red color, which means an increase from 2 to 4 degrees over the following years that we are going to live. And these are data from 2023. Last year was the warmest year ever. And I also put yet, because it seems it's going to get worse with time. This is a figure from 1940s to now, and you can see the increase compared with the mean of the pre-industrial period. It's an increase of 1.63 degrees Celsius, which is a lot. But what if we look into our region in the Mediterranean area, which is Catalonia, a region in Spain? During the last 2 years, 2022 and 2023, the increase on the temperatures compared with the last decades has been 2.7 and 2.5 degrees, which is a lot. There is a thing here at night that we call tropical and torrid nights. Torrid nights are when during the night you are over 25 degrees Celsius. When I was a child, before 2003, there were no nights like this. And in 2024, this year, we have had 25 nights during the summer, which are torrid nights, and 67 tropical nights, which is also very warm nights, but not so much. So things are changing. We are not in Finland, but things are getting warmer over the last decades, and here are some of the data. These are also a very clear figure from the evolution and revolution of temperatures in Barcelona, and you can see clearly the pattern, the sharp increase of the last years. Well, it's not only temperature, it has effects in our societies. For example, we're facing the worst droughts almost every year in our region, in the Mediterranean area, also in Italy and other countries, but here in Barcelona is a very big problem. It is also expected to imply the rise of the sea level, and it will cover, it is expected to cover with water some of the areas in the coast of near Barcelona. Sometimes we have very heavy rains, which imply floods and problems we have seen last weeks in Valencia, for example. And we are also having a very high risk of wildfires during the summer. So it poses us a very high risk at many, many levels. For example, this is the increase of the risk of wildfires in Europe per country. You can see the first one is Spain, the country with the highest increase of risk of wildfires, but almost all the countries have had some kind of increase in this risk of wildfire. It has also a health impact related to this risk. For example, the smoke we breathe when there is a fire is related to an increase in mortality risk and other comorbidities. And what about us as pharmacists, as healthcare professionals, and climate change? You already know this data. Healthcare is related to 5 to 10% of the total carbon footprint. And if healthcare was a country, it would be the 5th country, top 5 after China, United States. But what about drugs or medical devices that we're going to cover as pharmacists? These are data from France, including drugs and medical devices. It represents 50% of the total carbon footprint of healthcare, which is a lot, and it means that we can do a lot of things and try to improve it. Especially because we are healthcare professionals, and climate change, climate crisis is a health crisis. And why is this a health crisis? Because almost a quarter of the global deaths in the world are related to the environment. And focusing specifically on the global warming, there is a wide range of problems associated, like, for example, injuries, increase of risk of cardiovascular diseases, respiratory problems, mental issues. So lots of problems directly associated with this pattern of warming. This was in 2003, we had in Europe one of the first and worst heat waves that were associated with more than 70,000 excess deaths in the continent. In Spain, there were more than 15,000 deaths, and other countries like Italy, France, and other countries they had also a big impact on that issue. If you look at the figure on the left, you can see that there is like a fantastic temperature of almost 70 degrees Celsius with no risk or not increased risk of mortality. But when you are in a colder place or in a warmer place, there is an increase of the mortality risk. The problem is that it seems that the warm figure, it's not so bad as the cold one, but it is only, the figure is only until 25. But we here in Barcelona, we are 30, 35, sometimes 40. And there are other graphs where you can see the sharp and exponential increase of the mortality risk in these high temperatures, okay? So we have, for example, data for 2023. There were 43,000 excess deaths in Europe. And it is expected that in the last part of this century, it will become more than 100,000 excess deaths in the continent, which is a lot, and that's why we have to anticipate and try to work on this to prevent these problems. Let's put an example of respiratory diseases, pneumonia, lung cancer, cystic fibrosis, asthma, COPD. There is a wide range of diseases in terms of respiratory problems. We already know that on one hand, contamination, but specifically also global warming is related to an increase of the prevalence of some of these diseases and also the decompensation and acute symptoms of these diseases. And it's like a very vague information. Let's put a more concise example. If you look at this graph here, you have January, February, March. It's like the months of the year. And then the colors, these lines here, represent the risk of mortality for respiratory diseases. The red one is from previous years, from 1980s to 1994. And you can see that in January, you have a high risk of mortality for respiratory diseases, and then it lowers with time with the lowest peak in the summer, okay? But now let's look at the most recent years, 2002 to 2016. It's the blue line, and you can see that there's been a shift in this pattern, and now the period of the year with the highest risk of mortality for respiratory diseases is the summer, because temperatures have changed over the last decades. So we have a problem, and in Catalonia, we want to face this problem. There are public health actions, which are in general public health actions. For example, we have these educational programs with this very funny and happy woman. They can check online. Sometimes it's focused for the families and caregivers, but sometimes for patients directly. They have videos in YouTube, specific infographics and PDFs, so you can download it. There are sometimes basic recommendations like these ones in the right. For example, two of them that are very important. You have to reduce your activities during the day, or you have to stay hydrated and eat well during these periods. But imagine you don't have any air conditioning. It's 35 degrees Celsius. What can you do? Because it's impossible to live like this. We have climate shelters, public climate shelters, which are normally closed spaces, although there are also some open spaces. And these closed spaces have air conditioning, so they have controlled temperature, and people can go there for free and stay during the warmest hours of the day, so that they can prevent having problems of these highest temperatures. We have 1,707 climate shelters in Catalonia. You can check it online. You can look in a map and see the closest space or the a type of space that suits you well. For example, I want a library, or for example, I want a hospital. Sant Pau Hospital, the hospital I work in, is the only hospital in Catalonia which is a climate shelter. We have online information, but we also have presential activities. So people is going there because we are a climate shelter, and when they are there, we have like daily activities, so we can give them some educations, tips to manage these heat waves, and also tips to manage their chronic conditions. And also pharmacy is participating in these sessions. We also have information for workers. So maybe if we are having a very high alert of high temperatures, they have to stop working in certain hours. Okay. We have also social considerations. Imagine you cannot pay your bill of the electricity, but you need the air conditioning because you can stay at 40 degrees Celsius. Okay. There is some ways to look for help, and they can cover it for you during summer or give you some type of support. Also for pets, you leave your home and you go to work and you leave your pet. They also have their own health, and you have to help them. So you have also tips for your cat, for your dog, etc. Apart from these general public health activities, we have operational plans. We have the national one on the left here, and the regional of the Catalonian area on the right. We divide population into 5 groups according to the risk level: very high, high, and moderate level of risk. For example, very high and high risk are people who are 75-year-old and frail or with chronic illnesses. So according to this, there will be different actions for each group. For example, we divide into three phases: phase 0, 1, and 2, these plans. Phase 0 is a preparatory phase. It happens in May, before the summer, and you have to coordinate, prepare people and activities and institutions. Phase 1 is, okay, we are in the summer right now. We are going to monitor every day temperatures, and we are going to alert in case it's necessary to do some interventions. So there are 6 risks of danger: 1, 2, 3, 4, 5, 6. You can see in red. These are the levels with the highest risk. Okay. And what do we do apart from monitoring? We send these warnings, and for the high-risk patients on the risk, the high-risk patients, we have daily updates of their census. It means we have a list with all these patients. We update the list, and the next point is we provide information to primary care so that they can contact the patients, their caregivers, give education, review their medication plans in case something has to be changed, etc. Okay. And then there is phase 2. It happens when we are in the highest temperature, highest risk levels. In this moment, we intensify the activities we were doing already in phase 1, and we also provide with additional measures because of the high risk moment. The impact on our body, what happens when we are facing these very high temperatures, okay? We have a very good system of thermoregulation, which basically consists on vasodilation and sweating. But there is a moment when this system is exceeded because you are living in 40 degrees for several hours. What happens then? We're not going to say everything, but we tend to dehydrate, and it's also related to renal problems. Also, we have hypotension, and everything, all of this together and other issues impacts on your heart, and you then have also head problems. And it's like a chain, and it's related to other additional problems. What happens? There are several types of danger for your body. You can have like mild symptoms here on the left. You can be a little bit worse with cramps, then exhaustion, and then you can have what we call a heat stroke. In this case, you have to be admitted in the hospital. The previous one, it depends. Maybe you have to go to the doctor, but heat stroke means you need to go to the hospital, because otherwise there's the risk that this person is going to die. Okay, so it's essential to know the differences between heat stress and exhaustion that also needs healthcare professionals, but compared with heat stroke, that it's a very severe situation when you need to be admitted and you need to correct your temperature very, very quickly. Okay, so you can see here the points: call for medical help immediately, use aggressive cooling, such as cold water bath, etc. Okay, so it's you need to act very, very quickly. And what about drugs and heat? We have a right to drugs. What about drugs and heat? You can look at very databases or documents. The one on the left here is from the Catalan Health Service. It's one of the documents we use. And the one on the right is from the CDC. To put some of examples, there are some others in other countries. Let's put an example with, this is a man, he's 80, okay? And he's living in Barcelona, in my city. He has some typical chronic problems that we can see every day, like atrial fibrillation with warfarin, bisoprolol, digoxin. He's also having hypothyroidism treated with levothyroxine, hypertension with amlodipine, enalapril, hydrochloric acid, heart attack, and then he's having atorvastatin and clopidogrel. He's also having diabetes and is treated with metformin, empagliflozin, and sitagliptin. He has some type of depression treated with sertraline, and also he's having sleeping problems, and he's having right now diphenhydramine and sometimes lorazepam. It's quite a normal type of treatments that we can see in many old elderly people. And you can ask to yourself, which medicines of this patient could lead to complications in periods of heat? You will say maybe 2, 3. I leave you like 10 seconds to think about what drugs could be related to some type of problem in this summertime with very, very high temperatures. Well, you say 2, 3. Let's ask Taylor Swift. She's saying maybe more than 2 or 3, because all of these drugs can have some type of potential problem in elderly people in the summer. So let's make a very, very quick summary of the situation. For example, atrial fibrillation, we have drugs like warfarin or digoxin that have an increased toxicity when you suffer dehydration. So this could be a problem. Or bisoprolol that can make some alterations in your thermoregulation, or can also cause hypotension. So there is an increased risk for falling because of the warm temperatures and also the drug itself. Okay. For hypothyroidism, we have levothyroxine. In this case, this drug is related to an increased heat production. This is something that we don't want it right now. And also decreased thirst, also related with dehydration and other potential problems that we don't want during the summer. For depression, we have sertraline, which is quite a first line drug for depression in the elderly, but even this situation, we have lots of potential problems with thermoregulation, decreased sweating, sedation, which can also be related to a high risk of falls at this moment, and hyperthermia in some cases. So also some problems to face. For hypertension, amlodipine, enalapril, and hydrochloric acid, all of them can have some type of risk of hypotension, and we don't want it so much because it can happen also during the summer with very, very high temperatures. But also there can be some changes with electrolytes. There's the risk of reduced thirst sensation. So other problems that can also impact the health of this person. Heart attack. After this heart attack, the drug is atorvastatin and clopidogrel. For example, atorvastatin can have some pharmacokinetic changes in can also be related to reduced blood vessel dilation, which means problems with thermoregulation again. And finally, with insomnia, diphenhydramine, you know, these anticholinergic effects that can decrease sweating and also impair thermoregulation. And lorazepam is a drug that causes lots of sedation in some cases and increase the risk of falling. That is an increased risk during these periods of very high temperatures. Okay. So, and finally, sorry, diabetes, metformin, empagliflozin, and sitagliptin have also other problems related to dehydration with an increased toxicity for some of them, and their impact on renal function that can also impact this type of patients during the summer. So there are lots of potential harms of drugs or things that have to be considered during the summer. Here are some of them. We have just check it with our example. But now the problem is, what do you have to do? Do you have to stop these medications, or do you have to decrease the dosage? No, it's a good question. And these and other questions will be covered by Sayoa. So I'm going to let her continue with this and other stories and the experience from Sayoa with the region, etc. So let's talk later. Thank you very much.
Thank you. Thank you very much, Noe. I think it was a very, very insightful presentation. Like many of the members of the network are right now struggling with this as well, like trying to determine what's the impact of heat waves in many countries. I know that we have people from Germany, from the UK. I know they had some severe extreme heat events in the past few years. So I think this is very, very useful. They didn't tell me anything about torrid nights when I moved to Barcelona. I'm living now in Barcelona, and I have experienced them, and they are very, very difficult nights. But yeah, thank you very much for this. We will get you back in the screen when we have the question and answer part. But thank you, Noe. That was a very nice introduction to the topic and very thoughtful also list of potential issues. And yet we have Sayoa, who, as I said, she's chief pharmacist in the Vienna Health Unit, which covers a small public health unit in the Basque region. And yeah, over to you, Sayoa.
Okay, thank you. I'm going to share the presentation. So yeah, I hope it's okay. Well, thank you, Eric, for inviting me to participate in this workshop. It's a big pleasure and also a big challenge for me. So let's see how we manage. Okay, as you said, I live and I work in the Basque region, which is a small region located in the south of Europe, the same as Catalonia. It's in the north of Spain, the same as Catalonia, but here we don't have the influence of the Mediterranean Sea. In our coast, what we have is the Atlantic Ocean, and this also influences our climate. And although the region is small, we also have some climate zones. And in general, I will not define it like being hot and sunny. We even have a word. You mentioned the continuous rain. Well, we have a word to name this soft and persistent rain, which can be a bit annoying, but is really useful and keeps our landscape beautifully green. And the name is Shirimiri. And now experts say that Shirimiri is endangered because of climate change. Here you have some pictures of the Basque Country. You may recognize some places. The picture below is from Vitoria-Gasteiz. It was European Green Capital 12 years ago. This is the place where I live. It has many good things, such as a green area. We call it the green belt surrounding the city, which allows us to be in close contact with nature, and also it helps us mitigate the negative effects of climate change. And in the picture, you can see the wetland of Salburua, very close to where I live. This is important for local fauna and flora and also for migratory birds. So in this context, I was really surprised a few years ago going to the beach and suddenly not being able to have a shower because of water restrictions. This was something that I didn't thought it could happen in the Basque Country, but maybe things are changing, as you said in the presentation. And moreover, in 2022, like in the rest of Europe, we faced also in the Basque region some big heat waves. So this was like an inflection point. And I'm part of the committee of a drug bulletin named INFAC, which is part of the International Society of Drug Bulletins. And we started to gather information of heat, health, and medicines, and we managed to finally publish this document, this bulletin. It's freely available in internet, and it's in Basque and Spanish. Sorry, there's not an English version. And most of the things that I've planned to tell you are based on this previous work. So this is like a little spoiler of the points that I would like to talk and then maybe discuss with you afterwards. And well, although high temperatures can affect the entire population, there's some risk factors that can make it difficult for the body to adapt to heat stress. Some of them are clinical factors, as chronic diseases or medicines to treat these diseases, and Noe has told us about this. Other factors are social or socioeconomic factors, such as living alone or living in houses that are difficult to refrigerate or not having the air conditioning, as Noe told us, or living in highly urbanized environments. And well, as you know, the combination of risk factors make people more vulnerable. So an individual who has one or more chronic diseases is socially isolated and takes some medicines is at the highest risk of developing a heat-related illness. As you know, there are some clinical conditions to be considered in case of extreme heat or heat waves, and I'm going to briefly mention these 5 conditions. Mental illness itself can increases the risk of mortality during the heat waves due to some factors. The first one is that neurotransmitters that are affected in depression and schizophrenia are also involved in thermoregulation. These patients have often reduced heat alert due to their mental and cognitive problems, and they are also taking some medicines that may impair thermoregulation mechanisms. Some of them were explained by Noe before, others like neuroleptics or antidepressant benzodiazepines. Okay, one of the cooling mechanisms of our body, and Noe told us, is to increase the cardiac output to bring heat to the body surface. So any cardiac disease or pathology that decreases the cardiac output will negatively influence the thermoregulation mechanisms. And moreover, patients with cardiovascular disease may also be destabilized in case of extreme heat or dehydration. What happens to people with diabetes? Well, their thermoregulation is also affected in the hypothalamus because of the decrease in sweating, and the reduction of the heat dissipation through the skin is also affected by their failure in vascularization. These diabetic patients may also have other comorbidities like cardiovascular or renal diseases that also increase the risk of heat-related illness. And well, in case of dehydration, glycemia increases, as you know, and subsequently glycosuria also increases. And this worsens the urinary fluid loss. This process can quickly lead to hyperosmolar coma and endanger the vital prognosis. And the issue is that this condition may also affect to well-controlled patients. So we have to take care of our diabetic patients too. Well, in general, dehydration also increases the risk of urologic infections and nephritic colics. And as you know, when there's a dehydration, it also can worsen the previous chronic kidney disease because of the decrease in glomerular filtration and renal blood flow. These patients, renal patients, are also taking some medicines like, for example, antihypertensive drugs or diuretic drugs. But as you know, they can have some problems with heat. Okay, and respiratory disease, well, Noe has told us that mortality is now changing and the pattern of mortality with the temperature. So we can say that high temperatures increase hospitalizations and also mortality of people with respiratory disease. And these hospitalizations may be because of the increase of air pollutants that increase the risk of exacerbations of asthma and COPD. And the increased mortality during the heat waves has been associated with systemic and airway inflammation and hyperventilation. So heat may affect the pharmacokinetic profile of some medicines, which may lead to changes in their concentrations. And let's talk about pharmacokinetics now. And I will show you some few examples. The first one is that dehydration may especially affect drugs with narrow therapeutic illness or index, sorry. Noé told us about the digoxin, but also think about lithium or anti-epileptic drugs. Local heat results in increased bioavailability of some drugs, cutaneous drugs, like, for example, opioid patches, or subcutaneous drugs, like think about insulin. The decreased renal function also increases plasma levels of some drugs, which are mainly eliminated via the renal. And the typical examples are non-steroidal anti-inflammatory drugs, ACE inhibitors, and angiotensin receptor blockers. And decreased in hepatic flow may also result in increased bioavailability, which is especially important for oral drugs with high first pass effect. And the typical example, as you know, are beta blockers. So let's talk now about recommendations in case of extreme heat. And I will talk about when and how to adapt the pharmacological treatment and use of medicines. The aim is to prevent the heat-related disease, and also some recommendations of storage and transport of medicines. Well, as evidence from clinical trials is limited, the strategies to prevent health-related illness are largely guided by clinical experience and observation. And it's recommended that before hot season, health professionals identify the vulnerable patients and the vulnerable patients for heat-related illness, and alert them about the potential risks they may be facing. Advice on the signs and symptoms of heart-related illness. Remember the slide of Noé of the differences of different level of problems that we may have with heat, and also provide them with clear instructions of how to reduce their risks and when to seek medical care. Well, in general, we can say that systematic reduction or discontinuation of drugs that may affect the thermoregulation is not justified. And instead, what is recommended is that the review and adaptation of the pharmacological treatment should be individualized, taking into account the conditions for which those medicines were prescribed, the risk of withdrawal syndrome, and the risk of adverse events. Another general recommendation is, as you know, avoid the prescription of non-steroidal anti-inflammatory drugs, which are especially nephrotoxic in case of dehydratations. And in summer, is more than ever more important to follow the recommendation of using always the lowest effective dose during the shortest time. We also should tell our patients not to take any medicines without health advice, including the OTC drugs, and also provide them recommendation on how to store medicines at home and how to transport them. So all the medicines that are available on the market have undergone stability tests, and based on the results of these trials, the stability and expiry date for each of them is established. So if we have some medicines which no special precautions regarding their storage, we can say that in this case, they are not degraded when exposed to high temperatures as high as 40 degrees for long periods, as long as 6 months. So in this case, it seems that we won't be having problems with these medicines. The medicines that should be stored below 25 or 30 degrees, when they're exposed to high temperatures for days or weeks, we can also say that they will not have impact on their stability. So no problem yet. What happens with some drugs that, as you know, need to be on the fridge in temperatures between 2 and 8 degrees Celsius? Well, in this case, they have to be in the fridge. And when the temperature outside is very high, we should just use them immediately once taken off the fridge. There's some specific pharmaceutical forms like creams and suppositories that are designed to dissolve and absorb at body temperature. So these are more sensitive to heat. And here the recommendation is not to use them if the appearance is changed. Okay, and how to transport medicines if I have to go to another place and I have to take my medicines with me. Well, these are the recommendations for patients. Of course, the medicines that need to be refrigerated, they should be taken into isothermal packaging. And it's also a good idea for the rest of the medicines to carry them in their isothermal packaging, but without refrigeration. And in the case of emergency medical vehicles, as you know, high temperatures especially affect to medicines in the form of oral solutions. So it's advisable to have them stored in isothermal bags. And another good recommendation is always to minimize the stock and replenish it more frequently. Well, the same as in Catalonia, we also have, in the Basque region, we also have a plan for prevention of the adverse events of heats. It's similar to the Catalonian model. I will just mention that how it works in few words. For the phase one, it would be that the meteorology agency, in this case Euskalmet, sends the weather forecast to the health authority, and based on the risk level, there are some different preventive actions or recommendations. Of course, there's other agents that need to be coordinated, like municipalities and local authorities, social services, sports authorities, and companies and occupational health authorities. And this is an example of general recommendations for the general population. These are recommendations to protect them from heat, to avoid dehydration, and also to take care of vulnerable people. There are more specific recommendations for this is for healthcare, for primary attention healthcare, and I've pointed out the recommendations which are related to drugs. We can see that the recommendation is to adapt treatments whenever it's necessary, not always, but when it's necessary, and especially diuretics. Avoid the prescription of non-steroidal anti-inflammatory drugs. And in the case of paracetamol, in case of fever and suspect of heat stress or heat stroke, avoid the prescription of paracetamol because it's not efficient. It's not. It will be useless, and it also can worsen a previous hepatic disease. This is the specific recommendations for hospital care, and as you see, it's only for medicines. It's only mentioned the adaptation of treatments whenever necessary. So if you want to learn more about how to prevent the adverse events of heat in the health, this is a nice document from the WHO, which can be in English, and it's freely available. It's very interesting. And this is my last recommendation. It happens to be the last book that I've read. And I just discovered Maggie O'Farrell with this book, and I think it's not going to be the last one I read of her because I really enjoyed a lot reading her. And well, this is more or less the things that I plan to speak with you, and now ready for discussion. Thank you.
Thank you very much, Sayua, for this excellent presentation. I'm devastated to learn that Sirimiri is in danger. It's a very classic thing in the Basque Country. It's impossible that you go to the Basque Country and you don't hear about Sirimiri or you don't feel it in your own skin. But great overview of the impacts and how you are tackling it in the Basque Country. I see that there are a couple of questions there. But if we can bring also Noe on screen, I can first ask you a question, a very, very, very specific question. Imagine that any of our members is trying to set up a system to prevent the impact of heat waves, and it's engaging with the local or regional governments. What would be for you the recommendations that you would give to these policymakers and to these specific pharmacists to start setting up a system that protects patients and medicines also from heat waves?
It's for me, the question? I think so.
It's for both of you, actually.
Okay.
So now that you speak first, you are the first one to answer.
Okay. I think you need to know to put together all the actors. So not to forget an institution. So it's not only primary care, but also hospitals, but also social care. We talk about people who cannot pay for the electricity bill. So you have to take into account many things. And then when you put it together, you need to plan um, in relation to your situation. It's not the same here in Barcelona than in the Basque Country. And to give very simple rules. I think it's the most important because healthcare, uh, it's a very complex system. If you don't make things easy, people won't do it. So, for example, in our case, we managed to have this daily list with very high risk patients. So primary care have when there is an alert, they can check on them or there is a way to contact the caregivers. So I think there have to be simple things and then know how to articulate also in a simple way. Related or in relation to drugs, it's as I just said, you don't need to change everything or to stop anything, but someone has to revise it. So it happens also before the summary. In our case, in phase 0, there are some people who are revising some of these medications for high-risk patients. And also, I don't think we have it completely well structured, but healthcare professionals have to be informed and educated, and sometimes it's difficult to reach all these professionals. So you can have a very good plan, and then if people are not doing all the possible, or they don't know how to do, or that they have potential interventions, I don't know. I think these are some of the most important things that you have to take into account.
Okay, all right. And you, Sayoa?
Well, I completely agree with Noe. He's explained it very good. And just I will point out maybe that we should start with awareness, raising awareness among healthcare professionals, knowing that which may be the effects of the heat in health. Just because we've heard about that, but I think that we need to be aware and then formed. First awareness and then formation. So I think that's the first point.
Yeah, that sounds like a very good recommendation. We have put together all the actors, including pharmacists. Keep it easy. I like that one. I think in the end it's about, you know, keeping it easy, simple, and being able to tackle this very quickly. Also, revise the protocols and the medicines, and obviously raising awareness of healthcare professionals. I see that there are a couple of questions in the chat. There is one question from Sarah who asks, and I think this question is directly for you, Sayoa, because she posted it while you were presented. She's interested to know what is where your data about the medicines being stable for 6 months at 40 degrees come from. I don't know if you have any paper that you can share with her or anything that you would like to share with us here.
Yeah, well, mostly all the things that I've mentioned are based on this publication that we had, the Impact Bulletin. So it's the references are there. Maybe I can give it. Well, it's freely available. If you write it in the internet, you will find it. Well, the bulletin is in Basque or in Spanish, but the references, some of them are in English. So I could just check it and maybe send it to the person. Yeah, if that's okay, because I don't know it now. But
All right. Yes, sounds good. We can send a follow-up email. And then there are two questions from Jane Conway. I don't know, Jane, if you would prefer to unmute yourself and put your camera on and ask them. Otherwise, no problem. I don't want to put you in the spotlight, but I think it's always nice to see faces. But yeah, if I don't see you appearing, I will just ask the questions. All right, no problem. I will ask them. So the first question, when your heat wave plans are activated, are there special group or staff who are involved, or is this something that the staff come away from their usual role to do? Is there a specific person in charge of dealing with this?
For monitoring and for specific institutions, they have specific roles. And then for primary care, there may be someone who is coordinating, but it's not their only role. But they have very clear roles. For example, in primary care, they know that all of them are, when they receive an alarm, are responsible for their patients. So they have the list and they have to check it. So in some way, in primary care, all of them are responsible, although they are doing other things at the same time. So there are specific people working in the monitoring and in specific institutions, but then in some way, many healthcare professionals are responsible for the patients or for specific activities. For example, let me 1 second more. For pharmacists in primary care, depending on the region, in the summertime, some of them will review medication plans. It's not something that is all across the country, but in some regions it's that way. So when they receive the alarm, they may check some very high-risk patients, or they will attend some questions from doctors with specific questions depending on the type of the way they work. Okay.
It looks like a good idea in the same way that we have people trained when there is a fire emergency, for example, in a building, like people that know how to bring you outside safely and not be exposed to the risk. It makes sense that in the healthcare facilities there is also one person that has a bit more of information than the rest on how to assess heat waves, and that can guide some specific healthcare professionals on that topic. I think it makes a lot of sense, that question. I don't know if Saya, you wanted to add anything else to that?
Well, I think that in Catalonia they have more experience with this and with the plan. In our case, we receive the emails with the alerts and give the recommendation that I show you, but we don't have the lists. I think that's a good idea, and I have pointed it to maybe try to implement it, because it's just a recommendation, but we don't do it like by protocol as they have it in Catalonia. So I think it's a good point that we may start thinking about that, because otherwise it would be like a heat wave coming and, oh my God, I should have done all the work before and now I don't. And yeah, I have the formation or I'm aware of that, but it would help to previously work it more. So I think I pointed it so to tell to the authorities and maybe just review a little bit the plan and put it more practical way. So nothing more to add. I think
that would be an excellent outcome of this meeting. And Jane has a second question. I'm not sure if you have the answer to that, but she asks if all hospitals in Spain have air conditioning, and if not, how was this rolled out? If they started doing that in the last years. I don't know if you have the answer to that question.
there are many hospitals in Spain. We don't know
that's
all of them, but I think it would depend on the hospital, and maybe newer ones will have better ways to cool the temperature. But I don't think hospitals that are from I don't know, older hospitals. I don't think they have this cooling system. So just you have to imagine how to move patients to places where are not. The recommendation is below 26 degrees, and sometimes it may be challenging to get in that temperature. But maybe Noah, you have something to say about this.
I think it depends a lot on the region also. For example, in Barcelona or in Catalonia, all the hospitals I know some of them, all of them have air conditioning. I don't know a hospital here in my area without air conditioning. So I think maybe because we have a tendency of warmer temperatures, maybe we already have introduced the air conditioning, and maybe in other countries with colder temperatures, maybe they are still pending on this.
All right. And then we have a very last question from Nuala Hampson, who asks if there is any shareable resource on how to advise patients in hot weather. Do you know any initiative with, I don't know, visual shareable information, videos?
Only related to drugs or in a more general context?
I think it's more in a general context on how patients could adapt to a hot weather.
Well, Sayo said, and I also put the example of our region. We have online regional webs where you can see videos and infographics with these messages like don't go in the sun in the warmest hours, be hydrated, so, and
Take
many
care of the
others.
vulnerable people. Yeah.
Yes,
I think there are similar messages, but with
yes.
different pictures maybe, but the message could be the
So
same.
I think in several regions of Spain we have online videos and uh, infographics and other things like this. So I put some of them, and and they have the web the links, the web. So if you show the presentation later, you can check on this and you can access, and you can also access to the ones Sayoa put on her presentation.
And this links actually very nicely with our next workshop, which is on how to communicate with patients to reduce their pharmaceutical footprint. We will be focusing on the topic on how to reduce the let's say pharmaceutical footprint, but also in the way we communicate it might be very similar in different areas, like the things that we discuss in this webinar might be very useful for also situation of heat waves or climate change more broadly. And I think this marks a bit the end of this workshop. We have a question and answer, a survey now going out for you on this this Zoom. It will be there in a few seconds. But yeah, I think it was great to have you with us. I don't know if you want to give just the very last message to the audience, something that you want them to retain. I think we talked about many things today, and there are many things to reflect on. But if there is anything specific that you want to highlight.
If it only one thing it would be, it's something that we didn't take into account before, and now we have to provide education and take into account when we review medicines or give advice on how to keep it at home. And I think it would be we have to learn more and work on this.
Okay, and Sayoat, your 10
Yeah,
seconds message, which
I
will
would
be
just
similar
say
to
the
Noel.
same. Yeah, I would say just raise awareness and learn from this.
All right,
Show all the
fantastic.
people and just.
And that's a big role that the pharmacists have in this, in raising awareness. So it was great to have you with us today. Thank you very much. And you can see in the chat that there is lots of positive feedback on this. So thank you very much. We'll see each other in the next webinar. And please answer the question and answer survey that you will receive when you log off.